Welcome to Chat with the Lawyer. I'm your host, Walla Blagay, and I'm here with my dear friend, Delegate Joseline Pena-Melnyk from the 21st District of Maryland, which is both Prince George's and Arundel counties. Welcome.
Thank you. Thank you for having me, and congratulations on your first year anniversary.
Yeah,
I seen and hear great things. Good for you. I'm very, very impressed and very proud of you.
Interesting. So tell me how you got into politics.
I was a community activist, and I was very involved. I was on I'm a lawyer, but I was a public defender and a prosecutor. And after I had my kids, I have 3 kids. My son is 16, our daughters are 14.
Wow, they've grown.
I know. Remember when they were very
They were
small,
so small,
right?
right?
You remember when I first ran 9 years ago. So as you know, I was active in College Park. And I was on the council for 3 years, and then I decided to run because I was involved in the community. I was coming to, traveling to Annapolis and testifying. I would organize the community, and we would fighting the University of Maryland. They wanted to build that bypass through the city, so I organized, and about 100 of us showed up in Annapolis with our T-shirts. And I have always been an activist and advocate, and I decided to run when Pauline Menace back then in 2006 decided to retire. And she had, she held that seat for 39 years. Wow. So everyone was running. There were 9 of us running for 3 seats, and there were 2 slates, as you remember. So I ran on my own. I organized the community and did it in a grassroots way. And we came in second, which was such a blessing. And I thank the people for believing in me.
That's good. Now you've passed a lot of bills that have impact on legal issues in the state. Well, of course, all bills do, but you've passed some key bills. So let's talk about that.
Thank you. I've been really very lucky and very blessed for the last 9 years. I have introduced and have been the main sponsor of over 50 bills. And again, not just by myself, my colleagues have supported it, and that makes the difference. And a lot of the bills I have passed have real implications, such as the one that requires that inmates that are incarcerated be counted at their home address rather than the prison.
Now tell us about that.
And that is a really important bill. Every 10 years for the census, we count the number of people that live in the state and the districts to make adjustments. So we discover that in Maryland, the prisons are mostly in Hagerstown, right? And they're in mostly 2 districts. So it's not fair when you think of the, one man, one vote, and you look at redistricting the way it's done. When this prison population is put in that particular district, it's sort of inflated. And this is a way to make it balanced. So I put in a bill that basically says you should count them at home, not at the prison, because when they get released, they're going to go back home. They're not going to live in that district. And the prisoners, the inmates, they don't drive the roads, right? Their kids don't go to that particular district, to that school. So it should be fair. They should be counted where they matter. And Maryland became the first state in the nation to require that. Since then, we have had a number of states that have followed Maryland, and that was my bill, and I'm very proud of that. That took a bit of work.
Just to jump into just relating to this issue, we had another show on Reentry, but what is the status of ex-felons, those that are leaving Hagerstown that come back to Prince George's County that want to vote? Are they able to vote in the state of Maryland?
Well, you know that we passed a bill this past session, right? And the governor decided to veto it. So we are going to have to come back in January, try to get the number of votes that we need in order to override that veto. I have spoken with leadership, and that is what we intend to do. I know the Black Caucus, which I'm a member for the last 9 years, we're having a meeting next week. We have a retreat, and I'm pretty certain that will be one of the issues in the bills that we will discuss in order to organize ourselves to make sure we have those votes that are necessary.
Interesting. Good job. Well, going back to some of the other bills that you've passed, can you talk about some of the other key ones?
Yes, thank you. This past session, I put in 17 bills. I got 8 of them through, but 2 of them that really touched me is one is called Carrie's Law. And Carrie was a young woman that lived in Texas. She was in her early 30s, had 3 children. She was going through a divorce. She went to visit her soon-to-be ex-husband at a hotel. While they were in the room, the kids were in the room, she and the husband were in the bathroom. They started to argue. The husband started to stab her. The little girl, who I believe was 9 years old, attempted to dial 911 from the hotel room, from the telephone, 3 times, but she could not get through. You know why?
Why?
Because when you're in a hotel, usually when you have a multi-line system, you have to dial another number to get out. And usually it's 9. So we don't teach our children to dial 911. We teach them to dial 911, but not 911. There's a difference. So basically what the bill says is that when you have a multi-line system, which actually, by the way, the General Assembly, if you recall, it requires you to dial a number first before you dial directly. So it basically says that in the state of Maryland, when you have a multi-line system, you can no longer have a prefix for you to dial a first responder like the police or an emergency number, which is great. And we're going to change it as well. The General Assembly will be changing it.
Now, does this matter even for businesses that have sort of the inner line where you do have to dial 9 before?
Yes.
Okay.
Yeah. And it's very simple. It's only a coding system, so very cheap. For example, for us to get it done, it's less than $200 at the General Assembly. You know, can you imagine less than $200 and you can save a life? And another bill that I put in, it's a young woman. Her name was Lauren, and she was a student at Laurel High School. So her mom, as you know, we get lots of emails. She emailed me and she said that she wanted to talk to me. So I called Councilwoman Mary Lehman, who you know, and she and I met with this woman.
Who is she?
Mary Lehman, Councilwoman Mary Lehman represents the 1st District in Prince George's County. And she basically met with me at Starbucks. And we talked to the mom. And the mom told us that Lauren, her 15-year-old daughter, was very depressed. Her grade had gone down, and she was a very good student. So she noticed the differences. She attempted and called the guidance counselor a few times and did not get a response. So on a particular day, Lauren asked her mom to go to CVS to get her some personal hygiene products. When her mom returned, it took 45 minutes. And she found Lauren. She hung herself with her belt, and she died 2 days later. So the bill, basically what we discovered doing the research is that every 5 years in the state of Maryland, a guidance counselor has to renew their license every 5 years. And they have to take 6 credits. So what I require, what the bill does, and is named after this young lady who committed suicide, is that one of those 6 credits, just one of those 6, has to be on mental health. Okay, mental health is usually an afterthought when we discuss healthcare. And as you know, I sit on the health committee for the last 9 years. So we have tried very hard to decrease the number of uninsured, but to make healthcare accessible to people. And mental health is usually not on the table. And we take it very seriously in the state of Maryland and in my committee. So the bill passed, the governor signed it into law, and it was a great way to honor that young lady. But most importantly, I'm really very impressed by the mother that she, instead of being depressed and staying at home, she decided to do something and to change the law in her daughter's honor.
Now tell me, since you sit on the health committee, now mental health has become a big issue because of some of the current events going on where people say, oh, it's about health, mental health when it comes to the children in Connecticut that were killed. It looks like the guy, Adam, had mental health issues. Is there more of a focus in your committee on implementing or increasing funding for mental health? What is there being done at the committee level?
When we passed, in Maryland, we passed a ban on assault weapons, one of the few states.
Right.
And one of the requirements in that bill was additional money for mental health, because it's important to do that. And also a lot of the new health insurance coverage will require mental health. We're also paying a lot of attention, and I know I have personally worked on that, to make sure that we have network adequacy when you look at your health insurance policy, to make sure that we have enough nurses and psychiatrists available, because that is often a complaint, especially when it comes to children, that you're not able to find a psychologist or a psychiatrist because the health insurance coverage does not have enough of them. So we're looking at network adequacy as well. And something else that we did in the General Assembly is that we passed telemedicine, and for the first time, the regs that are being regulated are going to include that we must include psychiatrists, nurses, and reimburse them as well. So we are very focused on that. And also opiates, opiates abuse. On our health committee, we expanded Medicaid for coverage for women and children.
That is really good.
So Maryland is pretty progressive. We are really, since the Maryland Health Exchange was created, despite all the controversy, prior to that, there were almost 800,000 people that did not have health insurance coverage in Maryland. Since the Maryland Health Exchange was created, we have covered over 300,000 people. So
wow.
It's working. It's absolutely working.
Wow, despite the glitches,
Absolutely.
right? There's always something.
Yes, but it's working.
So what are some of the other bills that you've passed throughout your 9 years that you want to discuss?
Well, one of the bills that I passed this session, just in April, as you know, the pharmacists usually, they have a very good relationship with the people that live in that particular community, right? Mm-hmm. And oftentimes they go to them first before going to an emergency clinic or just going to the ER. And I put in a bill that does the following. And I didn't know this, I don't know if you knew, but a pharmacist, if you went to your pharmacist and you took, for example, eye drops, and said to the pharmacist, can you help me administer the drug into my eye? Maryland law prohibited that pharmacist from touching that eye drop and helping you. So they could not touch those drugs that are called self-administered drugs. For example, someone that has diabetes, and they have to administer insulin. So I put in a bill, and the regulations will be created. The Department of Health must issue regulations and decide what the rules will be and what kind of drugs. This says that a pharmacist will be able to help with those self-administered drugs. And this is particularly important when it comes to the elderly population.
That is really good. We're going to come back and talk more about that, because that's a really important issue and something that many of the senior citizens in the community would want to hear about. So we're going to be right back, so please stay with us.
To someone going through a difficult time, one simple act has the power to make a difference. Hello.
Hi, Dad.
Reach out to the veterans in your life today. Let them know they're not alone.
Welcome back to Chat with the Lawyer. I'm your host, Walla Blagay, and I am here with Delegate Joseline Pena-Melnyk, and we've been talking about health issues and some of the health care bills that's been passed in the past few years. Now, you were talking before we went on break about the limitation with pharmacists, and you were talking about that?
Yes, so this year was great for pharmacists because we put in a couple of bills to help them be in the community and have a relationship with their clients and the patients. So the one that I was discussing was the one that allowed them to be able to help with the drugs that are called self-administered drugs, like eye drops. And that helps particularly the senior, because a lot of times people end up going to the ER, for simple things that they can get help with. And a lot of our seniors live by themselves, right? Mm-hmm. So when they end up in the ER, that really brings up the cost of health care. So we on the health committee have been trying to pass a lot of policies that will actually reduce that cost, but most importantly, make health care accessible to people.
Interesting. And what are some of the other healthcare bills that have been passed that you've been a part of?
I know that I put in a bill to look at the childhood obesity epidemic. in the state of Maryland. So that was a commission that we passed where a lot of experts came together and had certain recommendations for us to reduce the number of children that are obese. And that number, there are a lot of health disparities, and I am the chair of the Public Health and Minority Disparity Committee for the House. So we deal with a lot of those bills. And we found that regarding childhood obesity, for example, diabetes, heart disease, those are issues that affect our communities of color more so than other communities.
Very true.
And we have tried on my committee to create policies that will reduce that number, be it by granting grants. And I know that a couple of years ago, we created these enterprise zones grants, and we granted 5 of them, one of them here in Prince George's, to work in the very poor communities to make sure that they have access to a doctor, access to care. Regarding diabetes, regarding obesity, we have tried to educate the community on, for example, nutrition and what kind of food to eat, right? And it's very easy. Sometimes you just need a little education and to become aware of what to put into your body. And I find that people will do it if they basically have a minute to sit with someone and they go through that information with them. So the committee is very active regarding education, regarding providing accessibility, for people to be able to see a doctor.
Interesting. Now, what about e-cigarettes? I know you had some work on
Yes, we passed a bill this session, which I'm very, very happy about, very proud, that actually prohibits the sale of e-cigarettes. Those are the electronic cigarettes. They still have nicotine, and it's very addictive to a minor. And a minor in the state of Maryland is someone under the age of 18. So that is actually the law in the state of Maryland now. You cannot sell it to them.
Okay, and now is there a limitation in the state of when someone can start smoking?
Well, it's after 18,
Okay.
anyone can
So
go
it's
and
18.
purchase it.
Right.
But, we basically, for minors, we decided to make it very clear that you cannot sell those e-cigarettes to minors. Because people used to say, well, they're different than a regular cigarette,
Right.
but they still are addictive, and a child should not be smoking that. So we made it clear.
Was that something that was going on in the state?
Yes. Yes, so we basically respond. A lot of times on the health committee, we respond to, the needs of the state and things that we see that need to be fixed. So that's what we did in that instance. Something very similar as well is that about 2 days prior to us adjourning from the General Assembly, we learned that powder alcohol became, the federal government made it legal.
What is powder alcohol?
Powder alcohol is just, as the description of it, it's a powder, it's alcohol, and you basically dump it, for example, in a drink, in water, and it becomes a drink, an alcoholic drink. Wow. And it's powder.
Technology.
Amazing, right? So, but there's a danger of that with the young people. It's very easy for young people to get their hands on it. So we basically made it illegal for the sale of powder alcohol in the state of Maryland.
At all?
Yes. Maryland is very progressive. And we reacted immediately. You know how it is to pass a bill. They said, there are all these rules.
Yeah.
We're there for 90 days. Well, this bill passed in 2 days. So we passed it quickly and we reacted to it.
And do you know that whether there were stores in Maryland selling powdered alcohol?
No, because it was just basically it just became approved by the federal government. So we reacted right away because we come back to session next January. So we did not want to give time for people to start, selling it.
Interesting. And also, talk about some of the work that's been done in the disabilities community.
Over the years, we passed a lot of bills and have worked closely with the disability community and different group stakeholders. So some of the bills we have enacted into law are bills that allow and require coverage, for example, for some of the autism treatment. And there's autism is rampant. There are a lot of kids with it. So whether doctors are learning, how to diagnose it or what it is, but the numbers are growing. So we have dealt with coverage of the years regarding the disability community. We have also, when we were discussing the minimum wage, which we know we passed, and I was a co-sponsor of the increase in the minimum wage in Maryland, and it passed. We also discussed paying people that work with the disability community more money, okay? They work so hard and they're not paid well. So we have anywhere from, reimbursement for doctors to coverage as well as salary. Our committee is very active, and it's an issue that comes up every session because there are a lot of stakeholders in that community that make sure that we are, doing what we're supposed to do. And there are bills actually that have dealt with the IEP, IEP hearings.
Tell people what that means.
It's basically when you have a disabled child, basically the school comes up with I'm going to simplify it, with a plan. Is a sort of a contract, or what are the needs for that child? Mm-hmm. What is it that the school has to provide to make sure that your child is being challenged, that their needs are being met? Mm-hmm. So you have a team that is put together, and they meet, they discuss the child, and they implement that contract, okay, that program. Mm-hmm. So we have put in bills that deal with that particular issue over the years as well. Some of the other issues that we have discussed on our committee have been the HPV vaccine, okay? And that was very controversial, as you remember, and I put in a bill that created a committee to study the vaccine for that virus.
Now,
and
why is HPV very important?
It's very important because the data shows that if you are administered that vaccine, that HPV vaccine, which is a virus, okay, that basically this vaccine is the only known vaccine that can prevent that type of cancer.
Now,
and
HPV
that is why
leads to what?
It leads to cancer, cervical cancer. Okay. So basically, we put it in. It was controversial when we put it in as a bill to require the vaccination. So we basically slowed down, and instead we created a committee that it's basically composed of a lot of different professionals in the medical field to come together and come up with a plan. And that is what they're doing. They're sort of monitoring the numbers to see if, we should put in a bill later on that would require it and make it mandatory. On a personal note, I have 3 kids. My husband and I have Camilo, who's 16, who's going to be a senior this coming year. And the girls, Alejandra and Caterina, because they used to come to the office, and they're 14, they'll be 15 in 2 weeks. And all 3 of them, I talked to their pediatrician, I read about it, I became informed, and I made the decision, my husband and I, to give permission to the doctor to administer the HPV vaccine to them, all 3. It's a vaccine that it's both for boys and girls. Okay,
Interesting. I thought it was only for women.
No, it's for both boys and girls. And there are countries in Europe that are, they started ahead of us administering the vaccine to boys. So basically in Maryland it's not required.
Why do boys need it?
Because they also can pass the virus. Okay, they carry the virus. It's like any other disease. Okay?
Is it like a sexually transmitted?
It's a sexually transmitted virus, disease that leads to cancer.
Interesting. And why was it so
It's called the
controversial?
human papilloma virus. I hope I'm pronouncing it correctly, but it's the HPV. So basically, it's both for boys and girls. The data, the scientific data, is there. It's very clear that it actually prevents that particular cancer, not all cancers, that particular one, and that both boys and girls should, have that vaccine. It is not mandatory in the state of Maryland. It's a personal choice as a parent to become educated on it. And if you feel comfortable, you go ahead and pursue it. My family and I, we decided, being on the health committee, that I have read enough, heard enough testimony to know the benefits of it. Right. And we made that decision.
Now, of course, why was that so controversial?
Because some people in the community felt that it would lead to promiscuity. It would encourage people to have intercourse.
And why would that How does that connect?
I don't see a connection. But I am respectful of those that think that it does, okay? Because we, just like your 5 fingers on your hands are uneven, that's how people are, right? We all have, think differently, have different experiences, come from different backgrounds. Right. So I have to respect that, but I personally, my family and I, in being in health, have learned enough about it that I can see the benefits of it.
Now, is there a screening every year for HPV for women?
Well, your doctor, yes, when you go and you have your annual exam, right? Wellness exam, which we all do. Okay. Your doctor screens for that, among other things, like gonorrhea, all these other venereal diseases. Pap smear that they That's have? Correct.
Okay.
Yes.
Okay. That's interesting. So one of the biggest issues in the 2015 session was about the idea of the impact on black men and police brutality and all that. What's your take on that?
Well, I was the co-sponsor of a lot of those bills, and I know that you had, if I'm not mistaken, Delegate Jill Carter on your show, and she was a primary sponsor.
Well, she didn't come on yet. Didn't come. But she's going to come on.
She's going to come. Well, yeah. She will discuss. I don't want to take her thunder. A lot of those bills, but I was the co-sponsor on a lot of them. And what the Speaker and the President of the Senate did was that they created a work group with some people from the House, a few people from the House and the Senate, to go through the state, travel throughout the state, talk to the different police departments, look at the training, and come up with some recommendations.
For legislation?
For legislation for the 2016 session. I'm one of those people that was selected from the House. I am on the committee, and we have had 3 meetings already. The last meeting we had was last week, which I attended, which basically was at the Police Training Center, where we met with the board and we talked about the different requirements to become a police officer. So we are going to be meeting every month. Actually, we're meeting, I believe, next week. Again, actually twice this month. And we are talking to different experts to try to come up with recommendation, whether, how do you change the culture of a police department? How do you increase the number of police officers they look like that particular community? Because what we learn is that in some instances, for example, in Baltimore, the majority of the officers are Caucasian, where the population, in contrast to population in Baltimore City, is majority African American. So the department should reflect that particular community. So we are looking at the hiring. What is it? You're not attracting enough people. How can we change that at the number of hours required for different courses? And how can we make things better? Where can we make improvements?
And that is really good. We're going to have to come back on and talk about your experience and what's going to happen in the 2016 after session. We can talk about it.
Look forward to it.
But if anybody wants to contact you, can you let them know how to contact you?
Absolutely. My office, the number is 301-858-3502, 301-858-3502.
All right. Thank you so much.
Thank you for having me.
Melnyk. And if you want more videos, you can go to the website at www.chatwiththelawyer.tv. Thank you for joining us.